UroPatient. Tune in and see prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone. It is Saturday morning, and I'm your host, Vic Senese for UroPatient.com. Glad to have everyone on board. Hey, if you're watching and you haven't liked and subscribed, go ahead and do it. Can't hurt. All right. So, did you have prostate blockage treated, but the symptoms came back? Today on UroPatient, we're going to uncover bladder neck contracture after prostate treatment, why scar tissue forms, and how it blocks the flow. And more importantly, what can be done to restore that flow? So let's start talking about what a bladder neck contraction is. It's a narrowing or tightening at the outlet of the bladder that can make it harder for urine to flow out normally. Patients notice weak streams, straining, or feeling of incomplete bladder emptying, maybe what you felt before you had a procedure done, because it often occurs after prostate procedures. Can be sometimes occurring with aging changes or scar formations. Good news, usually treatable with minimally invasive procedures, so let's talk about all that now. Now consider this scenario. You just had surgery to relieve the obstruction symptoms from an enlarged prostate. Months later, you start noticing these symptoms return. Did my prostate regrow? No, most likely this is a bump in the road that's called a bladder neck contracture. So what is this? The bladder neck is a funnel-like area where the muscle that controls the flow of urine and keeps you from wetting yourself is located. And you can see from this picture, that little area where we're showing is right underneath the bladder and the prostate area. Now, sometimes a scar can form as a tight ring at this point after urologic procedures. This causes that blockage known as a bladder neck contracture. I like to say it's as if we kinked the hose. So why does this occur? Well, during procedures like prostate surgery, instruments are passed through that delicate tissue of the bladder neck. Friction, heat, long surgery times can all irritate the tissue. And the body does what it likes to do, and that's heal the area. Sometimes overproducing things like collagen and creating that thick scar. And that's going to shrink the opening. So when this occurs, it may be frustrating, and you might think, hey, did my doctor do something wrong? Well, you may notice that from these two diagrams here, that the risk is actually pretty low of this occurring. TUR, about a 2 to 10% risk. Holmium procedures like a laser, only up to about 5%. So even though these are pretty low, I always tell patients that if you have a complication and you're the one, that's 100%, right? But again, keep in mind, this is not something that's usually from somebody's bad abilities. Okay, so how do you know if this is happening to you? Well, the same symptoms that got you into all this and got you to go to the urologist are going to probably start recurring. Slow stream, straining to start, a feeling of incomplete bladder emptying, sometimes blood in the urine, and maybe even a urinary tract infection. Any of those symptoms could indicate something's going on. And you might think, well, I'll just live with this. I've been through an operation, and the last thing I want to do is go through anything else again, right? Well, the same problem that you had fixed was for a good reason, and that's to protect your bladder. And it's really important because the way a bladder muscle works is it doesn't get stronger by overworking it like you do when you're pumping iron. What happens is it gets weaker. So the more that the muscle has to work, the less able it's able to work. So if you think of a muscle like this is how the bladder muscle works. They're fibers that pull together. You start overstretching these fibers from blockage and they can't start pulling together again. You might even wear it out. You don't want to do that. Also, sometimes high pressure can form up inside the kidneys. And if that pressure is going on for a long time, it can actually damage your kidneys. So bottom line, this is not a problem you can ignore. Now, lucky for you, the doctor has some pretty simple ways to check on this. Most likely, urologists want to take a little look down that urinary tract with the cystoscope. That's a tiny instrument that they put probably down there when they were evaluating your prostate trouble. And they'll be able to see the scar. It's pretty easy to recognize it quickly. Other things that can be done that are a lot less invasive are tests like a uroflow, where they see how fast the urine is flowing out. If we see a sudden drop in that flow, then we know that there's something else going on. But again, that look inside is the thing that you need the most. That x-ray that you see, a retrograde, I mean, years ago we used to do those. I haven't seen that done in years, but it's out there just to be complete. You could do an x-ray to see that. And that's what it looks like if you saw that narrow spot on an x-ray. Now, even luckier for you, the treatment options are pretty simple. So, your urologist can often dilate or stretch that scarred area with something called urethral dilation. We have these special dilators that you can use sometimes even in the office. Sometimes it's a little too much discomfort. Don't feel bad if you can't tolerate it. Let the doc know. We can always do it under anesthesia as an outpatient, depending on how much they need to stretch it. Now, if this doesn't work, we also have some newer techniques involving something called balloon dilation with a special balloon that has a chemical on it that can prevent the scar from reforming. So, as you can see from this picture right above me here, the one on the left, this is what that looks like. A balloon is put into that narrowed area, that band, and it's blown up, and that causes the scar tissue to stretch and open. Now, it'll probably come back if that's all you did. So what we need to do then is treat it with a chemical. So there's a chemical on top of the balloon that causes that tissue not to regenerate, not to rescar. So pretty neat procedure. It's called Optilume. And we do that for the prostate too, but this is where Optilume got its start, was dilating strictures, and it made a big difference. Now, another way that we do it over here is you can see we've got that blasting procedure that can be done with the laser. We can actually put a little cut through the stricture and just pop it open that way. So those are for more difficult strictures that won't just work with a quick dilation with the dilators. You may wonder if this could happen again, and you'd probably be right. So typically people that form scars tend to scar more often. So the procedure you're doing to relieve the scar may cause a scar, right? Well, there are some options to prevent it from happening again. This is my favorite one. Self-catheterization, intermittent catheterization. Talked about it in UroNurse and UroPatient before, where you put a little catheter into the penis to drain it. Typically, patients that can't urinate and their bladder's not working have to do this, but you can pop it through the scar. So what you do is you catheterize yourself, put it in, leave it in for a couple of minutes, take it out once a day. And if you do that every day, after a while, it's going to cause the scar to form still, but in an open position. Now that's key. If you can get the scar to form open, it'll stay open and you'll never have problems. I've cured more scars this way throughout my career by teaching patients how to catheterize themselves and stretch their own scars. And the thing is, folks, it's not really even all that painful to do. So give that a consideration. Rarely, though, for some men, that won't work, especially those that have had things like radiation therapy where the scar tissue is just too severe. We often look at things like open reconstructions, rebuild the bladder neck, and rarely, and I mean super rare, urinary diversion. Again, uncommon. Usually we can handle this with the much easier and simpler things. Now, hey, here's something that you might be interested in. So you might say, how can I know if I'm having problems? You can actually do this thing called Proud P. It's an app that's found on Apple or on, I don't think it's made yet for, they were supposed to make it coming up for Google, but it's made for sure, on the Apple phone, iPhone, Apple phone, listen to me. But you can go to UroPatient.com and there's a program that'll tell you how to use it. So I've got a show on that. So anyway, what it is, it's a program that works on your phone, and your phone listens every time you urinate. And the phone is able to tell from listening to your urination how fast it's flowing, and it's really accurate. So if you think your flow rate is dropping or you're concerned, you want to be proactive and do something yourself, be sure to check it out on our website. So again, just to show you what that is, it's UroPatient.com. And you go over there and you'll see on the right side of the screen, you'll see that little box there. It says Proud P. There's a QR code, or you can click it. It'll take you over to their website so you can download the app And there's also the episode, Proud P Explain. You just click on that and you can watch the episode about how it works. Best part, you're going to get 10% off. So, hey, maybe save you some money. Well, I hope this was informative for you, and we'll see you next week. Well, there you go. So it's kind of uncommon, but it does occur. Typically after prostate surgery, you get a little scar formation from, as I said, from what was done. So it's important to treat that. Don't just try to live with it. It's not the best thing. So it's a lot of simple things that can be done. So it's not always complicated. Hey, I hope you enjoyed it. Let me know in the comments if you did. And coming up next week,
the Gleason score has long been used to classify prostate cancer, but when it comes to Gleason 6, grade group 1, the conversation is evolving. Many experts argue that this low-grade diagnosis behaves very differently from more aggressive forms of prostate cancer, raising the question, should it even be called cancer? Tune in next week to learn more.
So be sure to tune in next week. You know, it's one of those things that this really low-grade prostate cancer, people are questioning, number one, should I even have had a biopsy? Number two, do I treat it? Once you learn you have it. So tune in next week. We're going to talk all about it. Until then, enjoy the rest of your day, and we'll see you next week on UroPatient.com.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see if, baby, you're health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.